tight hip flexors, and lordosis. When observing from the side, it is possible to examine the position of the spinal curves in the sagittal plane. Special attention should be paid to whether the exerciser's posture is characterized by increased lumbar lordosis. If a lordotic position is evident, test the patient's ability to perform slight posterior pelvic tilt while standing with legs straight. In most cases of tight muscles, the patient will have difficulty in making the lordotic position disappear. With this test, it is possible to obtain a general impression of the lumbar spinal curve and of the length of the muscles that are involved in anterior pelvic tilt. Next step, bending the knees. Bending the knees also creates slight flexion of the hip joints and releases the flexor muscles of the hip. In most cases of tight muscles, the patient will have difficulty in making the lordotic position disappear. This animation shows us that a tight muscle pulls the leg up, hip flexion. In a closed movement cycle, the leg is fixed on the ground. In a closed cycle, the legs are locked on the ground while standing. The hip flexors pull the pelvis and lower back and causes an increase in lumbar lordosis. Knee bending is actually hip bending, which releases the flexor muscles and allows the pelvis and lower back to remain in a neutral position. How can these data be applied? In this test, we wanted to see whether bending the knee would allow an improvement in the lumbar vertebrae position. If we see an improvement and the lumbar lordosis is smaller, the reason for the increased lordosis is tightness in the hip flexor muscles. If the reason for the increased lordosis is actually tightness in the muscles, significant improvement will be seen.